During the afternoon session of the Regional Committee meeting for the World Health Organization that is being held in Islamabad, Pakistan, the Regional Committee is the most important annual event for the World Health Organization. Several topics were discussed. Foremost amongst them was emergencies and emergency care. There are 76 million people in the region who are suffering because of emergencies. There was concentration on how WHO is helping, how it's gearing up to increase its staff to be able to be there when needed. We saw a film that showed WHO in action in the region. We saw the drought in Somalia and how water was being given to the people. We saw the Syria situation, where it was very difficult at times to reach every child with the vaccines, and yet WHO was there at the borders, everywhere, giving the vaccines. We saw a lot of action, what WHO was doing and what it's gearing up to do in the future, making emergencies one of the main programs for WHO to be working on. We moved on from emergencies to polio eradication. Polio eradication was highlighted as being a must, that we are nearly there, that now only Afghanistan and Pakistan remain. The number of cases, true, have gone down considerably over the years, especially this past year. But we need the final push. And I urge everybody listening to make sure to be an ambassador for us, that the message goes to everyone that you need to immunize your child. This way, the world will be rid of polio soon. There was also talk about international health regulations. How can we combat all these diseases? It's not just jargon saying international health regulations. Every country is requested to report when there is something. There are times when it's a sensitive topic and countries may not want to talk about it. But for WHO, this is extremely important. Every country has to be transparent. Every country needs to come forward to say what the situation is so that assistance can be given. This was another very important topic discussed. Then Dr. Tedros Adhanom, the WHO Director General, today announced the establishment of a new high-level global commission on non-communicable diseases, showing how important non-communicable diseases are, meaning cardiovascular diseases, hypertension, respiratory diseases, diabetes, mental health disorders, all these things which are not transmitted from one person to another, and yet they are on the increase all over the world, especially in our region. The Commission's aim is to identify innovative ways to curb the world's biggest causes of death and extend life expectancy for millions of people. The high-level commission will be chaired by Dr. Sanya Nishtar, a prominent global advocate for action against non-communicable diseases, former federal minister of the government of Pakistan and civil society leader. One important happy event took place this afternoon as well, was the giving out of the Shusha Award. Dr. Shusha was the first regional director for the World Health Organization in the Eastern Mediterranean region. Now, an award is given in his name every year for the person seen as having given most to health. This year, the award went to Dr. Yasmin from Oman. Dr. Yasmin has done a lot for public health. Foremost amongst her work really was her ability to have made contraception and birth spacing in Oman a priority, and during her period of working there, it had declined considerably. She has also worked on breastfeeding promotion and the code on the breastfeeding, marketing of breastfeeding substitutes. A lot of accomplishments for Dr. Yasmin Jafar. Congratulations. These were the main highlights in the afternoon session of the Regional Committee of the World Health Organization being held in Islamabad, Pakistan.